FNP, or PMHNP. While both are advanced nursing roles, their patient focus and responsibilities differ greatly. This video breaks down everything you need to know to help you choose the right path for your career. First, let's talk about scope of practice. FNPs provide primary care across all ages, including preventive care, screenings, vaccinations, and healthy lifestyle promotion. Acute illness, diagnosis and treatment of colds, flu, infections, and injuries, chronic conditions, managing diabetes, hypertension, asthma, and more. Family planning, contraceptive counseling, pregnancy, and postpartum care. On the other hand, PMHNPs provide mental health care, including diagnosis, assess and diagnose conditions like depression, anxiety, bipolar disorder, and more. Treatment, create treatment plans with medication, therapy, and referrals. Management, monitor progress, adjust treatments, and support patients and families. In summary, family nurse practitioners focus on physical health and wellness, while PMHNPs specialize in mental health and emotional well-being. Now let's talk about salary. PMHNPs typically earn slightly less than FNPs due to factors like location, higher salaries in areas with a higher cost of living. Experience, more experience often leads to higher pay. Employer, private practices, specialized clinics may pay more than hospitals. Specialty, high demand or niche specialties can boost earnings. The average annual salary of an FNP is $161,706, which is higher compared to the average annual PMHNP salary of $147,027. Next, let's talk about the difference in medical conditions treated. Though both are advanced practice nurses, FNPs and PMHNPs treat different conditions and specialize in distinct areas. FNPs treat common colds, manage symptoms with medications or home remedies. Infections, prescribe antibiotics, antifungals, or antiparasitic treatments. Injuries, treat sprains, fractures, and cuts, and refer as needed. Chronic diseases, manage conditions like diabetes, hypertension, and asthma. Women's health, address menstrual issues, pregnancy, postpartum care, and menopause. PMHNPs treat anxiety disorders, generalized anxiety, panic, social anxiety, and phobias. Depression, persistent sadness and loss of interest. Bipolar disorder, alternating mania and depression. Schizophrenia, delusions, hallucinations, and disorganized thinking. Substance abuse, addiction to alcohol, drugs, and other substances. Eating disorders, conditions like anorexia, bulimia, and binge eating. Trauma disorders, PTSD, and complex PTSD. Next up, certification and licensure requirements comparison. Both FNPs and PMHNPs must meet specific education, certification, and licensure requirements to practice. Education. Both require an MSN or DNP. FNPs focus on primary care, while PMHNPs specialize in mental health. Certification. FNPs can be certified by ANCC or AANPCB, while PMHNPs are certified by ANCC. Licensure. Both need state licenses, typically requiring an active RN license and completion of educational and certification requirements. Now, what are the differences in nursing programs? While both FNPs and PMHNPs share some common coursework, their specialized training reflects their distinct areas of expertise. Here's a simple breakdown. Both FNP and PMHNP programs cover pathophysiology, disease mechanisms, pharmacology, medication use for conditions, research, evidence-based practice and research methods, but here's where they differ: specialized courses. FNP, primary care for all ages, including adult, pediatric, geriatric, women's health, family planning, and chronic disease management. PMHNP, mental health care, covering psychopharmacology, psychotherapy, psychiatric nursing, crisis intervention, and group therapy. Another common question people often ask is, what are the different work environments? FNPs work in hospitals, ER, ICU, med-surg units, primary care clinics, urgent care, specialty clinics, and school-based health centers. PMHNPs work in psychiatric units, behavioral health and addiction clinics, psychiatric hospitals, community mental health centers, and school counseling centers. In summary of everything, choosing between FNP and PMHNP comes down to your passion and career goals. Whether you're drawn to primary care or mental health, both paths offer fulfilling careers with opportunities to make a real impact in healthcare. Ready to choose your path? Visit LatrinaWaldenExamSolutions.com for more tips and tricks in becoming an NP.